Kirsten is a child who is full of life. Inquisitive, social, just fun-loving, and she brings a smile to so many people's faces and to us each and every day.
I'm gonna go behind the crowd.
Well, it was in December when we had noticed that there was just 1 week where she just kind of laid on the couch, and it was so unusual for her. She no longer wanted to go to preschool. She wasn't interested in dance. Where she used to run around the house with endless energy, she would run around and have to sit down, kind of catch her breath. And then she became very pale and started taking many more naps.
1, 2, 3.
Both of us had said, we really need to get her into the doctor. And thank goodness to our pediatrician we went in, I explained all the symptoms. I said, I've been watching this for 2 months. I said, this really is not our daughter. I said, there's something else going on. And she listened and she said, well, let's do some blood work. Kurt took her to get blood work done. And on Monday they had called to say her counts were low, but we want to have the test redone. So she had asked us to go to Morristown Memorial Emergency Room and have the blood work done again for a second opinion. We went just thinking we were going to go for the blood work and come home, and after doing the blood work again is when they discovered that she had leukemia.
Today in the United States, the statistics are that we see about 20,000 young adults and children in pediatrics will be diagnosed in the United States on a yearly basis. Usually the most common type of cancer that we see is acute lymphocytic leukemia. Half of them, or more than half, will present of common symptoms and signs that can mimic viral infection, can mimic a lot of other things. For example, their fatigue, their endurance is less. Parents will say that the kid is not able to go upstairs as he used to run around the house. And the first thing we always tell the family, whatever is causing it, we'll be able to take care of it. Kirsten had what we call the common childhood acute lymphoblastic leukemia. It's common between 3 and 5 years of age, and this is the commonest type of cancer we see in children below 15 years of age, and is the most curable. So Kirsten, the first couple of days we started the chemotherapy. Some of it is given orally, some of it is a muscle shot, and the other was given intravenously. Kirsten was home in about 3 days because we try to do most of our treatment as an outpatient. The more we keep the family intact and the kids sleeping at home, the better it is for the family.
The first month is definitely the hardest. You are, at that point, you're processing the fact that your child has leukemia, and you're trying to learn all the medicines and how is this going to affect our life on a day-to-day basis. And they also put her on a steroid called Decadron. But you also see how that medicine affects your child. And that's the first sign of just, going, wow, this is not fun for them. She gained 10 pounds in a 2-week period. Basically was on all fours trying to get up the steps. No interest in activity, just sitting around and talking.
To put that in perspective for you, 10 pounds doesn't sound like a lot, but that was 20 to 25% of her body weight in a 2-week time frame. If they are under 10 years of age, then they respond to the treatment much easier. Girls, in Kirsten's case, it's going to be 2.5 years that she's undergoing treatments or therapy associated with leukemia. Boys, it's 3.5 years. Because for some reason girls just respond to it better than boys do, or quicker. Since the initial bad news, everything since then has been very good.
Mommy, where does this go?
I bet Miss Trisha will let you push the buttons. She's inquisitive. I mean, she wants to know, what are we doing today, Mom? Are they just doing my counts, or am I going under?
Yes. Are they going to do my counts in a little while?
Yes.
Now?
In a few minutes, when Miss Eileen or Gina come in, or Trish, when they come in.
Will it sting a little bit?
You tell me, does it sting when you have the magic cream? Her first stay in the hospital was a week. It was the beginning of her treatment, and you ask, what happens? Part of you is still in shock. She's having many new procedures going under with the anesthesiologist, and some of it is very much a blur that first week.
She has a team of 4 doctors. They were fantastic, and like I say, keeping us informed as to what was going to occur and why.
And they also had social workers. They had 2 social workers that would come in, would explain things to Kirsten at her level.
Just to dissipate some of the anxiety, that really is what the goal is, to help them attempt to reach some semblance of normalcy as their child undergoes treatment.
Do you think you're going to take my job over soon? Mm-hmm. That would be fun. Would you like to be the boss, or would you like
Once
to be
we
the
make the diagnosis, we sit with the family and we talk about what is the diagnosis, what does it mean, why do we have to treat it, which means the prognosis. We also give them the treatment options. We also go through the side effects of the treatment, whether it's chemotherapy only or radiation therapy, and what to expect as side effects of the treatment during the treatment. What are the immediate side effects? What are the late side effects can happen even 5 years, 10 years, or 20 years to expect as they grow in their adulthood. So the treatment depends on the type of cancer, it depends on the stage. Most solid tumors is finished within 6 months to a year. In leukemia, it depends on the type of leukemia. Usually it runs between 2.5 years or 3 years. If it's the acute myelogenous leukemia, which is the common type in adults, usually is within 6 months they finish the treatment.
We have very special friends out in Kansas. She's done something very wonderful for the family. Herself and another friend together have come up with 50 people in the United States to pray for Kirsten. She sent an angel to each of those families that they have decorated and are mailing to Kirsten for her prayer angels. It's just been an amazing thing.
A couple of weeks ago, the family had the good news when we did day number 29 from the start of treatment. She went in a complete remission of her leukemia, so she's doing great.